Senator Carter, I saw you in the audience, and you have two bills before our committee, and if the committee's okay with it, we'll hear everything at one time for you.
Thank you.
And just to let you know, present to provide information, but just here was Beverly Hadel with the Louisiana Coalition for Access for Autism, that in support of the last bill.
Mr. Chairman, if we can start with Senate Bill 72, I'd appreciate it.
Very good.
And I have some guests who join me at the table.
So, members, we'll be hearing Senate Bill 72 by Senator Carter. And Senator Carver, I saw you have Senator Tarver really busy this session.
Yes.
Yes, it's good to see. He's gotten very involved in the legislative process.
He's really working hard, man. He's got a lot of bills.
You've really activated him.
I tell you, you never know what motivates someone to really just, we know he's been a tireless fighter behind the scenes, but he's stepping up this time.
He's got his bayonet. He's got his bayonet, and he's ready to go.
He's taking him out the coffee.
Y'all, it's good to see us laugh a little bit again.
I'm going to begin, but I think we have Ms. Elma Stewart and others that would join me. Mr. Chairman and members, thank you so very much for the opportunity to present this very critically important piece of legislation. And I'd like to thank all the organizations that have been a part of working to this point of creation. And I'm going to, just because it's so important that you know how many people stand with us and how many women's organizations across the state that have stood up with the significance of what this bill calls for. The American Association of University Women of Louisiana, Basic Necessities, Berean Wellness and Community Center Support, Campty Community Development Center, Carmore Industries, Center of Hope for Children and Family Services, Center for Resilience, Individual Families and Communities, Daughters of Zion United, DPEC, HER, H-E-R Institute, Hadassah New Orleans, Health Education and Promotion Solutions, Healthy Birth Ambassador, Healthy Community Resources and Advocacy, Inc., DBA Healthy Community Services, Heart and Hands, Inc., IWO New Orleans Independent Women Organization, LAMPS, League of Women Voters of New Orleans, LIFT Louisiana, Louisiana Cardiovascular and Limb Salvage Center, Louisiana Health and Center for Health Equity, Louisiana Coalition of Equal Rights Amendments, Equal Pay, Pay Equity, ERA Coalition, Louisiana Federation of Business and Professional Women, Louisiana Progress, March of Dimes, Mary Amelia Center for Women's Health Equity Research, Tulane University of Public Health and Tropical Medicine, Metro Council District 10, National Birth Equity Collaborative, National Coalition of 100 Black Women of New Orleans Chapter, Inc., National Congress of Black Women, Daughters of Zion United, National Council of Jewish Women, Greater New Orleans Section, New Orleans Maternal and Child Health Coalition, New Orleans Now, Louisiana Now, Nikki Scott Incorporated, One Soul Delivered, Operation Restoration, Planned Parenthood Gulf South, Pumps to the Polls, Saul Light Foundation, Sister Midwife Productions, Representative Mandy Landry, the Family Tree Health Start Program, the Preemie Mom Coach, the Promise of Justice Initiative, the Queen Esther Academy, Top Ladies of Distinction, Tulane University. As you can see, this is a very broad base of support for the creation of the Office of Women's Health. We know that women's health takes on very unique characteristics and very unique needs. We know that LDH has been a partner in working in these areas. But we also recognize that we still have a tremendous amount of growth and a tremendous amount of opportunity to address many issues that have caused us to be 49th and 50th in the country. We can do better. Martin Luther King once said, of all forms of inequality, justice in health is the most shocking and inhumane. We haven't lived up to Dr. King's words in Louisiana. The healthcare system in Louisiana has failed women. 51% of the citizens of Louisiana are women, and results show that we've not provided the resources women need to take care of themselves. We currently are the second highest in low birth rate, second highest in infant mortality, 60th of pregnancies are unintended. Black women in Louisiana are 4.1 times more likely than white women to die in childbirth. Highest rate in the country in babies born with congenital syphilis. Third highest adult obesity rate. Ninth highest cancer diagnosis rate. 1 in 4 women are victims of domestic violence. Severe lack of access to opioid treatment and medication for addiction treatment for mothers and women in reproductive age. These are the issues that are impeding the quality of life for state's women, and it is the past time the state enable women to be their own best friend. SB 72 creates the Office of Women's Health within the Department of Health so that there will be a laser focus on collecting the necessary data and providing the resources on education women need. Led by an assistant secretary within the Department of women's issues will always be at the table when resources are being allocated. The office will also be empowered to seek out private sector grants to expand and complement the available government resources. This is a special day. It's an opportunity to put our money where our mouth is. We talk about the issues that are important to women. We talk about the fact that we all are supportive, and I know we are. Here's an opportunity for us to demonstrate that we're going to isolate resources, centralize resources, and make sure that we have a distinction that we will have an Office of Women's Health to deal with those issues. I'm happy to answer any question. I'm happy to defer to one of the great leaders that allowed me to partner with their team of great leaders to bring this legislation forward. And I want to publicly thank her for her incredible effort, not just now, but year-round, to bring these issues to the forefront. Ms. Stewart?
Thank you very much. Would you like a question now? Mr., just one moment.
Yes.
Senator Mizell, you have a question.
Thank you, Mr. Chairman. Hello, Senator Carter.
And Pro Tem, how are you?
You know, I appreciate you doing this. I just want to speak up for the rural women who don't have resources. We can't walk down the street and find health care. There are food deserts where, connected to the maternal mortality and the high blood pressure and the diabetes. So, I know your environment is very urban, and I appreciate that, but I'm asking for equal time for the rural women of Louisiana who don't have the resources, basically. They can't get, if they know where to go, they don't have a transportation to get to it. And, it's a concern. I see it in my district, but it's all over the state. So I just want, when this is up and going, for there to be a concern that's statewide, not just centralized in the urban areas.
And let me be clear that this is an Office of Women's Health.
Right.
And it's Office of Women's Health for all women.
Right.
Rural, urban, doesn't matter. I want that to be abundantly clear if it wasn't in my opening, and I certainly respect
Well, no,
and
when
appreciate
you're
you.
reading the list, it's mostly,
Well, but these are groups that are supporting.
Right.
And I'm sure there are others.
Right.
It's not an exhaustive list, and we invite others. And I think your point's well taken. You've given me an opportunity to emphasize that, and you are 100% right. We know that the health disparities exist throughout the entire state.
Right.
We know that the need for resources and access to health care for healthier outcomes is needed in all of our communities. And I will say without fear of contradiction, this list that I shared with you is not an exhaustive list. It just happens to be the list that I had access to this morning. But I will tell you that the office in its creation will have at its core mission and task to provide healthy outcomes, opportunities for women throughout the entire state, missing absolutely no section.
Right, and I appreciate. And there are some strong partners in rural Louisiana healthcare on here. I mean, Tulane has done a heart study in Bogalusa, I believe, like 50 years. So there are a lot of strong partners in rural areas. But I just wanted to give you that to think about, because it's a great opportunity to affect all women. So I thank you.
Duly noted, and we hear you, and
Thank
it's
you.
there. So
Thank you,
bless
Senator
so
Carter.
much.
Thank you, Mr. Chairman.
Thank you very much, Senator Mizell. Ms. Stewart, the floor is yours. Thank
Good
you.
morning to the esteemed Senate Health and Welfare Committee. Thank you for allowing me the opportunity to speak this morning. My name is Alma C. Stewart, and I'm president and founder of the Louisiana Center for Health Equity. We're an independent, statewide, nonpartisan, nonprofit organization. I'm also a registered nurse of more than 40 years and a career civil servant. I worked for the Louisiana Health Department for 27 years, and I now continue my public service through the Louisiana Center for Health Equity by working to address the increasing disparities in health and health care across the state of Louisiana. Today, I'm speaking on behalf of the members of our campaign to establish the Louisiana Office on Women's Health, which Senator Carter has already read off the list of those organizations. I'm speaking on behalf of almost 50 of those organizations, and I'm sure, as you all have already said, there are others who are supportive that have not had the opportunity to sign on yet. We are here to, the campaign is comprised of these organizations that have come together to serve as a cohesive voice for better health outcomes for Louisiana women and families. And we are here in support of Senate Bill 72. I would like to read, well, we've already read that, so I'll skip that point. My key talking points are that I first want to say that women are the backbone of our society, and from our families to the workforce. And when women of Louisiana suffer, when we're not at our best, the entire state suffers. The campaign, the goal of this campaign is to get this legislation to establish, really the goal is to get an office that is dedicated solely to improving the dismal health outcomes for women in this state. And here's why. And I'm not going to bore you with a lot of data, but we are ranked 49th nationally in overall health outcomes for women and children. And here are some opportunities for us to make some improvements. We can improve in all of the areas related to birth outcomes. We already heard about maternal mortality, infant mortality, premature births. The list goes on, low birth weight. So all of the areas as it relates to birth outcomes, we can have substantial improvements. We also can improve in chronic conditions, such as diabetes. Diabetes is so prevalent among women in Louisiana, and obesity, which is on the rise. Even in the midst of COVID-19, obesity is increasing, which is going to impact the health of women in this state. Also, the social conditions such as hunger and food insecurity, which we also see having increased amid this COVID-19 pandemic. And there are people who are truly suffering. And this is just to name a few of the areas that we can improve. Women in Louisiana have fared poorly for too long as compared to other states. And we believe it's time to change. It's time for a change. There are, as Senator Mizell said, significant disparities in Louisiana, and they're pervasive based on both gender, race, and place. The disparities among in rural areas are, we can do better. I'm just going to keep saying we can do better. And the same as it relates to race. Maternal mortality for African American women is 4 times that of our counterparts, and we can do better. In fact, I have with me today a mother who I would ask to go ahead and come up now that I would like to speak, Miss Weatherspoon Collins. If you will come on up, Miss Collins, and join us here at the table. So I just want to say that, what we're talking about today is not new. I've been in healthcare now for well over 40 years. Working to address these issues all across the state of Louisiana, first starting in Shreveport, Louisiana, making my way to Baton Rouge. And so I've seen firsthand the issues, especially around our women and women's health. And so, social determinants like access to health care, which we've come a long way. We now have most of our citizens covered with health insurance coverage. But other issues such as socioeconomic status, the environment, transportation, the work environment, all of those have played a role in the differences we see in health outcomes. And so the efforts set forth in the state to alleviate these disparities, and there have been many, and I applaud all of the efforts that have been taken over the years to improve our health and our health outcomes, but we still have opportunities to do more. There are still more opportunities for us to do more in these areas. And therefore, we propose an Office on Women's Health as a potential solution to improving the quality of life for women and families in Louisiana. This is really about people. It's about the quality of life, not just, improving our health rankings, but we want to improve the quality of life for women and families in this state. And so the creation of the Louisiana Office on Women's Health is to provide education, leadership, and coordination on critical women's health issues, evidence-based prevention and treatment programs and services, and policies to improve the overall health of women and girls in Louisiana. And I'll close by saying today, Honorable State Senators, we, the campaign to establish the Louisiana Office on Women's Health, ask for your support of the Office on Women's Health. And so I have with me today, and I hope you will allow her to speak, Mrs. Argaret, let me say your name right, Argaret Witherspoon Collins. We have invited her today to tell you why she supports this Office on Women's Health.
Ms. Collins, welcome to the committee.
Good morning. Thank
Good morning.
you. And I appreciate you all taking the time out to listen to my story. Again, my name is Marguerite Witherspoon Collins. I would like to introduce you to the people who I...
Ms. Collins, can you put the mic a little closer to you so we can hear you? Thank you very much.
I'm talking concerning my daughter and my grandson, which passed last year in March. Her name was Jessica DeJuan Collins Ruffin. His name was Jace Lawrence Michael Ruffin. The services that she received through the healthcare system was not one that was assertive toward her and her needs. She herself was obese, but we enjoyed the message that she was pregnant, and this was right after her marriage. So she had been married 6 months, and she was pregnant. So we enjoyed that service. We went to all her prenatal cares. We talked with the doctors, but my concern was the doctors were not listening. They were not listening. Jessica had been having problems with her blood pressure prior to her being pregnant. Also, Jessica was an asthmatic, which used a nebulizer at home, and she had a rescue inhaler with her at all times. They never looked at her records to see what type of precautions they needed to take while she was pregnant. Prior to that, she has an 11-year-old she left behind. She had an 11-year-old that she had the same problems with the 11-year-old, but those doctors were on it. Those nurses were caring. Those people actually cared about her, even though she was obese. They cared. This particular system, going through that, Jessica stayed in the ER. She stayed in the ER with her blood pressure. Her blood pressure was elevated the whole time she was pregnant. She was never listed as a high-risk pregnancy. Never. The day in particular, March 2nd, Jessica arrived at the emergency room. She went to the doctor first. The doctor refused to see her because her insurance had lapsed that day. So she was refused treatment. She called me and told me, I said, do not come home. Go to the emergency room. She went to the emergency room. In the emergency room, she called me. She said, Mama, my blood pressure is still high. I said, what is it, baby? It's 280 over 190. You know what the emergency room did for my daughter? They sat her in the emergency room. When they sat her in the emergency room, 20 minutes later, she went into a seizure and had a stroke. Then they came, but what they didn't realize is God put it in plan where she could tell us everything that happened in that emergency room. Because she was obese, she told us that she was thrown around like nothing. She was tossed. Never mind that she had a baby in her. She was tossed around. When they finally decided to take my grandson out, he was bruised from the top of his body to the bottom of his body. He was shucking when they took him out. So they gave him a diagnosis, and it's endocritis. That's what they gave the diagnosis for, which was absolutely not true. This doctor did not follow protocol into seeing that she had already had problems and she should have been categorized. She should have been. She was not. She went through that stroke. When we talked to one of the head GYN doctors up there, and I explained to her the situation, that this doctor did not follow protocol, and this doctor did not care that my child had a name. My grandson was named before he was here. These are people. This little girl was a master cake baker. She was an excellent mother. She wanted this little boy. She has an 11-year-old girl, which is named Alana. Before I finish with my story, let me tell you what my 11-year-old granddaughter told me. She said, "Granny, I love you and I love TT, but I can't talk to you all." She said, "I can't talk to my mama because I have to go and talk to a piece of concrete. Do you know that cut me like a knife?" Going back to Jessica, after they did the surgery to remove my grandson, he went to NIC ICU. She was in ICU. The hospital staff said they were not equipped to handle Jessica's situation. If you were not equipped, you should have not actually admitted her under your care. So they then sent her to New Orleans. To New Orleans, we was in the room every day. We're a close-knit family. So if one is sick and one goes down, you will see the entire family. Every day Jessica spent in New Orleans, I was in New Orleans. My daughter was in New Orleans. We stayed. Her dad stayed. Nobody left her in ICU alone. Every day a doctor would come in and we would ask questions. You know what the doctors did? They turned around and walked out the room like we had no voice. I would say, "What are you giving her that for? Why is this?" We did the 3 W's. Who, why, what? We asked questions. Nobody gave answers. Nobody gave answers. My thing was, somebody needs to be accountable for answering the family's questions. I still have questions, but I get no answers. That particular day when Jessica got ready to leave, well, no, let me go back. A week prior to that, the first week she was there, she fought the medication. They had her under medication to keep her asleep, paralyzed, keep her in a coma. This little girl here is an angel from God, and not just because she's mine. She fought through the medication they gave her. They finally had to wake her up. When they woke her up, the first thing she said, "Where's my mama?" I said, "I'm right here." She said, "Mama, I have to tell you something." And that's when she began to tell me what happened from the day she was in the emergency room till the day she came to New Orleans, Ochsner. She also told me, "Mama, do not leave me in this room by myself." I said, "You don't have to ask that question, because someone will be here with you at all times." When that day occurred, they put us out the room. They put the entire family out of the room. They kept us out of the room for 4 to 5 hours because they say they needed to work on her, not telling us she was coding, not telling her that they had gave her too much medicine and she was having an allergic reaction. It was so happened that a family was coming out that I snuck back in. When I snuck back in, I can't sleep now. You know why I can't sleep? Because I seen this huge man lying in my daughter's chest, pumping. I heard the sound of the line going flat. Zing! True, I thought it was only on television. The green heart had turned to red. All I could say was, fight, Jessica, fight. Fight, my baby, fight. This was my baby girl. I then sat on the floor and called my daughter. I said, you gotta come. I said, she's in here having a massive heart attack. In the process, I saw one of the nurses give her an EpiPen. We all know what an EpiPen is for. That was the first one. When my daughter came in, I ran out because I couldn't see anything else but the red heart. She came in, she said, Mama, they gave her 3 EpiPens. And I asked, why are you giving my sister EpiPens? We need to get her back stable. Well, how is an EpiPen going to get her stable? She had 20 bags. She had a resuscitation machine. She was on life support. All this stuff came into that room within that 5 hours they had us on the outside. I completely passed out. I didn't even know where I was. When the chapel came into the emergency room where they had taken me, she told me that my daughter had passed. I said, that's not true. I said, get my kids, that's not true. I said, let me out of here, let me go talk to my daughter. I said, because that's not true. This one here came in the emergency room and said, Mama, I have to tell you something. I said, what is it, baby? She said, Mama, she's gone. She's gone. I still sit at that door waiting on Jessica to come in and say, Ma, I'm home. She used to travel. She worked for FEMA. When I say anything that hit through storms throughout this country, FEMA would call her. She was on the first line out. She was dedicated to her children, to her child. She was dedicated to her family. And if anybody would have met Jessica, you would have fell in love with her, because each nurse, each doctor on that floor was in tears when she went flatline. I never thought I would see people cry over somebody they didn't know, but they cried. But I figured they were crying because they did something wrong. They did something wrong. They overdosed my baby. They didn't go by prior pre-existing conditions. They didn't take precautions. They looked at her because she was oversized and obese. But that little girl may have been obese, but her daughter was a dancer. And everywhere her daughter went, Jessica was right there with her, dancing up a storm. Well, now her daughter no longer wants to dance because her mom can't come with her. I said I wasn't going to get emotional. I said I wasn't going to cry because I needed you all to understand she and he were people, not just patient X. They're not just patient X. This is a book that I made my granddaughter, of memories of her mother. If I could take out time to let you see, this is Jessica. This is Jessica. Jessica's funeral was broadcast on Facebook. Jessica had a viewing of 3,000 abroad. She's a person. She's a person. Now, when I talk to her, because I'm used to talking to her every day, and she would calm me down and she would say, Ma, it's gonna be all right. Her best friend made a song for her at her funeral. Mom, it's gonna be all right. I need to know that you all hear me when I say somebody needs to be accountable for us as people that are utilizing the healthcare system. Somebody needs to be accountable that you're using the correct medicine from the doctors that spent 15, 20 years in school to learn my case, her case, my grandbaby's case. He passed on the 9th, his mom passed on the 15th, which should have never happened. The head GYN doctor called me, and I keep the message. She called me to let me know she didn't even know Jessica and Jace had passed. It was a month after, and she wanted to give me her condolences. But what she also said was, this should have never happened. I want you all to understand, we are people. We need to utilize the health system, but we also need the compassion, and we need the doctors to stick to the oath that they took, as well as the nurses, and not look at my color and my size. That is so disrespectful to our culture. As a people, as humans, we all deserve the same treatment. We all deserve to keep our children. We all deserve to keep our grandchildren. We deserve to live. And I know some of you can go home and kiss your grandbabies and kiss your children. My circle is broken. My circle is broken because somebody didn't care about the treatment she was going through. Somebody didn't care. Whoever sat her in the emergency room with a blood pressure of 280 over 190, somebody didn't care. But we need to fix it. We need to fix it. It has to be fixed. Because I don't want to know that some other family went through what I went through, what my family went through. I have always told my children, you make a mark in this world so somebody can see you, not for your color, for what's up here and definitely what's in here. I have always told them that. And that's the way they live. My son, I'm proud of him. He's Eugene Collins Weatherspoon. He's the NAAC president here in Baton Rouge. I'm a mother of a bus driver. That's my son. Wow. But I need you to see us as people. As people. I say on my job every day when I pick up the people going to CATS terminal, these are people that deserve my services. And I will give them 100%. I've been driving 28 years. I have 4 college degrees. But I decided to go back to driving a bus because I enjoy helping people. I thank you and I appreciate you for hearing my story. Now let's see, can we hear this story and fix the problem?
Thank you very much, Ms. Collins, for your testimony. And I can tell you on behalf of all the committee, we give you our sorrows. And I'll turn it over to Senator Barrow, who has a question or comment. I just do want you to know that this committee and the makeup of this committee, we've been knowing each other for a long time. And this committee really volunteered for this service to protect the health, safety, and welfare of the public. So you have an audience that not only hears you, but wants to work with the issues you've talked about and with Senator Carter. So your testimony touched us and gave us reinforcement to keep trying to do the job we try to do to protect the public.
And I appreciate it.
Thank you very much.
Thank you.
Senator Barrow?
Thank you, Mr. Chairman. And I know your son very well. As a matter of fact, he's my brother. He's my fraternity brother.
Okay.
And the chairman has placed it and said it very well. I want you to know we do hear you. And the only way that we begin to change things is to be intentional about the change. I want to thank my colleague for bringing this bill. Ms. Stewart, who has been on the battlefield for as long as I've been elected, fighting, and this is long overdue. I am so sorry for your loss, and there is nothing that can replace that, bring it back.
Never.
But hopefully, maybe we can even name this bill in her honor, or I have it tagged with her name attached to it, so that we remember. We always remember. And her life was not in vain. But I do want to say to you that there are some steps that can be taken. Going to the Louisiana State Board of Examiners and reporting your situation, because you gave some very specific details that occurred. And if that has not happened, I would like to encourage you to do that, because certainly we don't want anyone else to go through what you guys have been through. I am trying my heart myself not to cry, because I don't know that pain, but I know similar pain. And I remember when the closure of Earl K. Long was transpiring, and they was trying to move the patients over to the lake. But if you wasn't insured, we didn't have all the pieces of the puzzle in place. And there was a lady that had endometriosis. And she had to go back to Earl K. Long, and they were not completely, because they was transitioning out, they didn't have all the equipment. And they tried to save her life. And she bled to death. And I promised myself that day, because I've always been an advocate for access to health care, but I promised that I would always make sure that I was on the field fighting to make sure, especially women, because our makeup is different. We have a lot of plumbing, like somebody said. We got a lot of stuff. And every woman is not the same. Even if you're the same race, your body makeup is not the same. And you need sometimes just the individual care that is necessary. So, Senator, I say to you, because I looked for the fiscal note when I first saw the bill, and I didn't see it till this morning. And so I know the process that it has to still go to finance, which, thank God, I'm on that committee along with my colleague, Senator Boudreaux, so we can fight for it in finance. But I do believe that we need to go back and revisit it, because I don't want that to be what normally becomes the stopping gate for things to move forward. When you attach a price tag to it, and it seems like it's too much for us to bear. But let me tell you, everything that you mentioned, Ms. Stewart, if we want to move from the bottom, I've heard many of my colleagues ask that question, start addressing the issues that affect women and children. And I'm going to tell you, you're going to be seeing it, begin to see us not be at the bottom of every list, or not be the least healthiest in every category. Because at the end of the day, when women are taken care of, then they're able to take better care of the children, and then consequently everybody benefits as a result. I know this may not be the appropriate time. I see we have an amendment. I'd like to ask that we adopt the amendment, Mr. Chair.
And then I want to address.
Yes,
quickly.
very well. Why don't we do the technical amendment?
Yes,
Because
please.
it's strictly technical.
Okay.
And we do have a motion by Senator Barrow to adopt set of 506, which is purely technical.
Yes.
By Senator Barrow. Any opposition to the technical amendment adoption? The amendment has been adopted.
And Senator Barrow, you make as always, very compelling comments. Your comments are very thoughtful, very real, and I know the passion, and we share your view. We heard testimony this morning that was very difficult for us all to hear, but it really speaks to a greater issue. And as it relates to the fiscal note, this is first cut fiscal note. I firmly believe that this fiscal note will be drastically reduced and maybe even go away. And here's why. We believe that the resources are already within the budget of LDH. This creation and recognition will add some bells and whistles, but by and large will reorganize and distinguish those resources to make sure that they're enhanced. So we're not necessarily bringing in something that's new as much as we are laser focusing those resources to make sure that there is a specific concentration on women's health, healthy outcomes, preventive medicine. So I appreciate, and if we can, if it has to go to finance, we'll be there, and I think we can make a compelling argument that this is the time to put our money where our mouth is. And I know that resources are limited in the state,
Yes.
but I also know that resources are needed to make a difference, and that's why we're here, to make a difference.
I totally agree. As a matter of fact, I sent a note to them while we were sitting here because I believe that it can also be absorbed within the department. But I wanted to make sure that it would not be absorbed to the point where it become ineffective. So I want to make sure of that because I'm not about just creating something just to say we created it. I want it to be meaningful and to be intentional and to begin to address the real issues that we face in our state as it relates to the care of women. And certainly as a country girl who grew up literally in the country, know about the gaps in the rural areas. And that's another reason why, for me, this is so real and so close to my heart. So, Mr. Chair, I'm not going to continue because I think if I continue to talk, I will cry. But I thank you for your courage to come and share your story. And then I would like to encourage you, if you've not already done so, to report this to the Louisiana State Board of Examiners so that they can take a further look into this and see where all of the missteps happened, where everything happened, where all the failure occurred. Because certainly your daughter, based upon what you shared with us, should not have been in that situation, and we should not be having to share her story in this light. And so, at the appropriate time, Mr. Chair, I'd like to move the bill as amended.
I want to say one thing for the record because I committed to LDH. LDH has some concerns just about organization and funding and just tweaking. Not opposition, just wanting to have some more time to research and determine best fits and best practices. So I have committed, and I'll say on the record that I've committed that prior to us having floor action, that we will meet with LDH with an attempt to answer those questions for them. But I've also said to them that this is important.
Yes.
And we're going to move forward to make this happen. But we will not do it in a vacuum. We will not do it without giving everyone who has an interest the opportunity to have input that will hopefully make it better. But we are not going to dance with this to the extent that it's not real.
Thank you.
It will be real.
Thank you.
And so that's my commitment, Mr. Chairman,
very
and
much.
I've always honored it, and we will hold it until such time as we've accomplished.
Thank you,
those
Senator.
things.
And I'd like to be an author as well.
Sure, very much. We have the co-author sheet. Senator Hinchkins?
Thank you, Mr. Chairman. And Mr. Chairman, I wanted to say that if anybody else has a questions for my dear friend, Senator Carter, or these two ladies, I will get back in line because I do have a LDH cleanup question. So if there's anyone else for this table,
Sure.
I will back up and wait for that moment.
Sure, we'll hold that. And just so, there's a lot of people that do listen on the internet and watch on the internet. Just the conversation that took place between Senator Barrow and Senator Carter is basically, if this bill does have a certain price tag to it for the general public, it then is referred to the Senate Finance Committee for a second debate. So we do want you to know we are a policy committee. We work on healthcare policy. The Senate Finance Committee would look at the price tag, and that's what the discussion back and forth was going on about the price tag. So just for everybody didn't get a chance to see the fiscal note, that's what the discussion centered around. If there's anybody who would like to speak in favor of the bill, now would be the opportunity. If not, Senator Hitchkins would like to talk to somebody from LDH, right?
Yes. I think I saw Assistant Secretary Kim Hood in the room earlier.
Is Senator Hitchkins, let me just make sure that no one was denied an opportunity to speak on behalf of the bill. Yes, you did. Is this Ms. Murphy? Yes. If you'd like to speak, now would be that opportunity. And then we'll get to you, Senator Hitchkins. And we would ask, do we have some other bills on the agenda? We want to have everybody fair hearing. Please stay on the bill itself, and if you do have anything to talk about, we're happy to hear it, but let's not duplicate any testimony right now.
Hi, my name is Sarah Stickney Murphy. I'm from River Ridge, Louisiana. I'm here to speak in support of this bill. My friends and I regularly trade the names of doctors that we consider to be ones that listen to us and treat us like intelligent human beings who believe us when we say that something is wrong. I am currently pregnant with my 4th child, which is very exciting but terrifying. Louisiana is a very dangerous place to be giving birth. I gear up for delivering children like I'm going into battle. With my first baby, I was subjected to an assault by a doctor during the birth. I was subjected to an invasive procedure called an episiotomy that was later deemed unnecessary, despite the fact that while the doctor was performing the procedure, I was repeatedly telling him that I did not consent, that my midwife was telling him that it was unnecessary, and no one listened to me. With my first 2 pregnancies, I was diagnosed with severe preeclampsia. Listening to the story earlier was very difficult for me because literally there but for the grace of God go I. With my second pregnancy, at around a little shy of 36 weeks, I noticed that there was something wrong. My face got very swollen, my hands and feet got very swollen, and I decided to take my blood pressure at home. My blood pressure at that point was somewhere around 200 over 120. I took myself to the emergency room where the attending physician asked me, "Who told you to take your blood pressure at home?" As opposed to, "Hey, that's really high, that's a problem." It took 2 days of me fighting with doctors to take my complaint seriously and get the necessary tests done to show that I had preeclampsia with severe features. And I then had an emergency C-section at 36 weeks. I recognize that I had a lot of privilege in going into those situations. I have good insurance, I'm white, I'm college educated, I can speak medicalese, I am a native English speaker, and I'm, relatively well off. I honestly believe that if layered on top of the misogyny that women routinely face within the medical community, I was also subject to racism, xenophobia, classism, homophobia, or transphobia, I do not believe that I would be alive today. It is absolutely necessary that this office be formed. It should have been in existence for a long time. And it's really, really necessary that in addition to looking at access to health care by geographic region and through insurance, that we're also looking at the discrimination that women routinely face from medical providers. They are not listened to. Our concerns are routinely dismissed. I was told that my blood pressure could be high because it's really stressful to be pregnant with a small child. Following both of my births, was really tired all the time to the point where I couldn't get out of bed. My doctor told me, well, being a mom is tiring. It's exhausting. I finally found a new physician that would listen to me, and it turned out that I had such severe anemia, she was surprised I was ever able to get out of bed. All that would needed was a blood test and somebody to believe me. This happens to women daily. It is even worse if you're Black, if you don't speak English as your first language, if you don't have access to great health insurance, if you don't live near an excellent medical facility, or if you just don't have the energy to fight tooth and nail with your medical providers. So I very much support this bill, and I really, really, really hope that we can start looking at why it is so dangerous to be a woman in Louisiana, why it's so dangerous to give birth here. Thank you.
Thank you very much for your testimony. We appreciate it. I do not have any other cards of requests for testimony, so at this time, Senator Hinchkins would like to talk to Ms. Hood, if possible. Ms. Hood, are you here? And anybody else from the department that would like to join. Senator Hinchkins, the floor is yours.
Thank you, Mr. Chairman. I guess I'll take over after she announces herself.
Welcome.
Make sure everybody can hear me. Good morning, Mr. Chairman. Good morning, rest of the committee. Thank you for having us here. Senator Hinchkins, do you have any questions you want to start with? Or?
Yes, just one simple question, and that is just walk me through where the department is on this study, research. Give me the country boy version of we know where we want to go, and are y'all working to get there with Senator Carter, and what's going to be the process from here on out?
Yeah, so just before I start, my name is Kimberly Hood. I'm the Assistant Secretary for the Office of Public Health, and I have Amy Zapata here with me. Can you introduce yourself?
Sure. My name is Amy Zapata. I'm the Director of the Bureau of Family Health within the Office of Public Health.
I can't hear.
I'm the Director of the Bureau of Family Health within the Office of Public Health.
Okay.
Thank you, Senator.
So we were asked to prepare a fiscal note to try to look at what the cost would be. So I think everybody's got a copy of that. Estimates were about 11 TO positions that would cost about $1.8 million over 5 fiscal years. So we submitted that information. But I think what we would really like to highlight here today is that we have already got a meeting scheduled with Senator Carter to talk about how we can evaluate this proposal. Want to make sure that the impact on existing programs and infrastructure doesn't end up creating a financial disincentive. So we've got lots of different departments within the Office of Public Health that deal with women's health issues. So the Bureau of Family Planning, the Nutrition Services where WIC resides, for example, Chronic Disease and Prevention also has a women's component. So we've got multiple funding streams that exist within those departments. And so just want to have a conversation with Senator Carter so that he understands how all of those work, and we make sure that whatever decision ultimately is made by the committee and by this legislature ultimately has the power and the authority to do what's been described here today.
And Kim, I thank you for that. And I know y'all interested in this also. But you can take the temperature of this committee too, and you can tell that we're very interested in this. Absolutely. And I just want to make sure y'all are making yourself available to Senator Carter and make sure we get to the end process.
And Senator, they have been incredibly available. And to be clear, nothing that was said today, nor the intent of this bill, is to blame, criticize, or challenge. It's all to get better. I think we all recognize in our daily lives we can all get better. And we recognize that there are some areas that we haven't been as strong as we should be. Issues of women's health is one of those issues that we know we can do better. So I compliment the Secretary of LDH. I compliment all of the staff and these leaders. They've been overwhelmingly supportive and willing to sit down to make sure that, there's sometimes with any good legislation there could be unintended consequences. And in a very thorough and thoughtful way, to do good, we want to make sure that we do it right. And so I want to thank you guys for publicly agreeing to, and what you've done privately in your everyday lives to bring about those healthy outcomes. None of us are perfect. We just want to be better.
Thank you, Senator Carter. Kim, thank you very much for your answers.
My pleasure.
Mr. Chairman, that's it.
Thank you, Senator. We appreciate you. Senator Boudreaux, the floor is yours.
Thank you, Mr. Chairman. And Senator Carter, thank you for bringing the bill, and to those who have testified. I know we could stay here for days. Secretary Hood, if y'all just hang tight for 1 minute. Just one. Yeah, please. I'm sorry. Yeah, it's all good. Yeah, we could have had testimony for days on what are some of the needs throughout our state as it specifically relates to women, and I know you guys could have done that. I think the message is clear, and to follow up with where Senator Hinskins was going, earlier today I had a conversation with the chairman and serving on health and welfare and finance. I was concerned, as we spoke before, about the fiscal impact. And I think it's clear that we it gets to finance, it poses, this is the policy committee, as Chairman Mills said, and it's based on the reading the tea leaves, everybody on the committee feels that there's justification to move forward. How we get there, I have asked him to work with you all in advance of going to finance, so that we can. I want to make sure I don't put words in Dr. Phillips or Secretary Hood's mouth. I know it's a priority for them. If we put down 12, 13 positions in this post-COVID environment, it's not going to get the type of hearing it needs. I would hope that we can have that meeting, and while it's a fiscal note over 5 years, if it means we have to phase that in with existing staff, existing personnel, looking at some of our existing contracts that we have within LDH, and maybe reshuffling the deck a little bit to get this going, that would be my flavor. I would like to be a part of that process of moving the bill in that direction, as opposed to us passing something and telling the department, now you're mandating to do it, which I know Senator Carter does not want to do. And I think if we can have that dialogue and that discussion with all the things that you all are doing today, still recovering from hurricanes, from freezes, from everything that's happened this past year. So I don't want to diminish at all, like we have people sitting around not doing anything. But I also want to bring to light that if we looking at 13 positions in going to finance, we're not gonna walk out of that door with our heads high. We're going to be very disappointed. So in advance of that, if we can start some discussion and some dialogue on how we do that, how we phase this in, because I think the most important thing is to make the commitment, which has been made, to move the needle when we talk about women's services, when we talk about the disparities. And you all have been, you're busting at the seams on so many things. We're adding one more to that list, but I think in his opening, Senator Carter said it. If we don't do this, we remain where we are in so many of those categories. So I just wanted to, first of all, thank you all for the heavy lifting that you have done and continue to do. I'm not one of those that sit up here and beat up the Department of Health. I think we have the most resources, it's the largest budget. We get 3 times the match when we're talking about federal opportunities. I would hope that this also would ignite some momentum, so that we can look at, as a result of reshuffling the deck, of some type of reorganization, are there any tangible benefits that we can capture at the federal level, so that we can bring even more resources to the state of Louisiana. So I don't want to keep rambling. But I wanted to make sure that the department was put, and Senator Hinskins did it, put in a position where you're not the bad person or you're against something, but by the same token, this process calls for, at the end of the day, there's going to be some votes made. If there's not consensus, it's not what we want, and it's not something good. Okay.
And Senator Boudreaux, I can tell you, and that's why I was emphatic to make clear that the department has been a great partner.
Yes, sir.
Emphatic that this was not intended in any way to cast shade or criticism. In fact, it is an effort to give more resources, to laser focus resources. And I have looked at this very carefully, and we have combed through this, and I am very confident that the fiscal note can be lessened. And note that fiscal note was over a 5-year period.
Yes, correct.
So when you break that down, it's significantly less when you do, and it's annualized. But even within that, we've had good conversations of how we cannot duplicate efforts and make sure that through some careful discussion, which the department has absolutely been great in discussing with us.
And again,
I'm confident that,
yeah.
even when we get to finance, if there's a fiscal note,
Yeah.
it will be one that we can more than
Can live
justify.
with- Yeah, and the last thing I'll say, Senator Carter, is that in addition to that, it was alluded to in the bill that there are some resources within the governor's office to do that.
And
I know-
federal grants as well.
Yes, and I know the governor is on board and being an advocate of improving our ability to serve everyone, but in particular women and those disparities. So I think without having the benefit of talking to his people, I know they'll
But
be
I
on
have.
board. You have, sir?
Yes, sir.
Well, let's get it together. Thank you. Thank you.
Thank you always, Senator Boudreaux. And just on that note, which you said, with the Office of Women's Policy and the Governor's Office, I think we can kind of work in a more strategic way, possibly. Senator McMath, the floor is yours.
Thank you, Mr. Chairman. Thank you, Senator Carter, for bringing this and presenting today. Secretary Hood, you mentioned a few programs a little while ago. Can you drill down a little bit more on the services or programs that the state already has in place that addresses women's health?
Yeah, it's a little bit of a laundry list, but they include WIC, the WIC program, newborn screenings, pregnancy risk assessment monitoring systems, pregnancy-associated mortality review to the point of both of the women who spoke here today, whose testimony was very powerful, and I appreciate their testimony very much. Injury and violence prevention, reproductive health programs, reproductive health integration initiatives, Well Aheads, which is the Wise Woman program, the Office of Behavioral Health, the Office of Aging and Adult Services, and Office of Citizens with Developmental Disabilities, and then the Louisiana Breast and Cervical Health Program that's located within the LSU School of Public Health.
And there's some dietary programs in there as well, I'm sure.
So the Office of Nutrition Services,
Okay.
Through there also, which is part of the
Right.
WIC program. as
So
well.
it sounds like, and I think we've all sort of gotten to this point here and there that the state of Louisiana and LDH already does a lot of what Senator Carter is seeking to do. We just don't have it kind of under one roof. That's
a little more than that, respectfully. It's not just about putting it all on one roof, Senator. It's about putting a concentration, making sure that it is in the forefront, making sure that it's very, and I want to be clear, because I don't want to diminish what this legislation does by suggesting that it just puts it under one roof. As you heard from the testimony from all of these groups that have testified, you heard the comment from the mother. It's a lot more than just putting it under one roof, very respectfully.
and I didn't mean to insinuate that that's all simply what we were trying to do. Clearly, I think by establishing this office, you're signaling that this is a top priority, which I think is.
It also attempts to enhance those offerings.
I guess my point is in regards to the fiscal note, I think we're at an area where we're doing a lot of this already, and to have $1.8 million over 5 years, I think I hope we're taking into account that this is not a dramatic increase. I think in services is my point. So, and I appreciate.
I'm not sure I understood that last comment.
I'm saying.
Are you suggesting that this is not as important as it should?
No. I'm saying it's not it shouldn't be as expensive as I guess.
I'm agreeing with
that's
you.
What I'm saying.
That's why I wanted you to get a chance to clarify
yeah,
that, because
okay.
I didn't hear it that
No,
way.
this
I want
is
to make sure people know.
This is extremely important.
Because I know I've spoken with you, and I know your support
very much
for these kind of issues. So.
Yeah. So I appreciate your helping me clarify. Thank you very much, Senator.
Thank you, Senator, for your help. Thank you so
very
much.
good. The board is clear, and out of respect for time, if it's okay, I have only cards of support, and I think Senator Carter talked about most of the groups that were supportive, and this solidifies the support. So we will put this into the record, all of the cards of support, and we did have two members from the Louisiana Department of Health, Amy Zapota and Kimberly Hood. So we'll also put that in the record. And Senator Carter, I think you see the temperament of the committee, but the closing argument is there for you if you'd like it.
Nothing more than to say thank you. Thank you for again, for these incredible soldiers that have been fighting this battle long before we've come to this table. For these incredible individuals who came forward and told their personal stories, and for every one of you, because I know you all have your own personal stories, and I know that you serve on this committee because you do really care, and that's why we are very comfortable with a policy made up of people, a committee of policymakers such as you all, that understand the significance of this type of legislation, and I thank you and ask your favorable passage.
Thank you very much. And before we vote, I'd just like to say one thing is, we did hear compelling testimony, and we so appreciate it. I would also like to say that I'd like to thank the nurses, the doctors, the pharmacists, all of the healthcare people, physical therapists that have decided to stay in Louisiana, that have decided to take care of our patients. And as Senator Barrow said, if you do have an issue that you feel that it's been wrong, please report it to the right regulatory agency. That's what they're there for. They're there to protect your health, safety, and welfare. So on that note, I just wanted us to know that there's some tremendous public servants that have said, when I graduate, I'm staying in Louisiana. And I think we should always remember that. Our job as a committee is to work on problems and address it. But I did want to thank all the healthcare professionals. So on that note, I see the board is clear. I have a motion from Senator Boudreaux to report Senate Bill 72 with amendments. Is there any opposition? Seeing there's no opposition, Senate Bill 72 will be reported with amendments. We thank everybody for taking time out of your day in this dreary weather to be at the Capitol, and it is good to see so many of you back here for testimony. And Senator Carter, you do have one bill left. Would you like to finish that one
May I
up?
please? Thank you, Mr. Chairman and members.
Thank you, Senator
Thank
Carter.
you all. Thank you very much.
We'll talk to you soon. Thank you.
So I see